Good afternoon. Thank you guys for being here on such short notice. So once I get my mask out of my earring, we'll start. So today we are here to talk about masks in our schools, specifically for those who are ineligible for vaccination, those under the age of 12 years. I've really tried to reach consensus among all of our elected officials, and for some I've been told that they cannot have an opinion until they see a mask order in front of them. So I've received recommendations from our Board of Health to issue a mask mandate for K through 6th grade, the Utah Department of Health, the Center for Disease Control and Prevention, the American Academy of Pediatrics, and several of our esteemed pediatricians and physicians here in our community have all recommended universal masking in the K through 12 setting. So as required by Senate Bill 195, the best way that I can articulate the gravity of this situation and what I see as the best way forward for Salt Lake County and to keep our kids safe and in-person learning is to officially notify Mayor Wilson of my intent to issue a mask order for school children under the age of 12 years in Salt Lake County. This order will include the exemptions that were detailed out in the state's K through 12 mask order from last year. It will also only apply to indoor settings. Again, I am focused on those who are ineligible for vaccination and have no other way to protect themselves from the spread of COVID-19. And I encourage our council and our mayor to be clear and straightforward with our parents and our schools over the next few days so that they know what to expect come school starting Monday and Tuesday of next week. Thank you.
Thank you. So earlier today, let me start over. So earlier today, I did receive notice from Dr. Dunn that she is requesting what is called an order of constraint for consideration. And I am here to announce today that I support her decision and I will not be terminating that request. I'm using some language that may not be so familiar to everyone in that the state has a new law in place requiring first that a Department of Health would notify with 24 hours advance notice of an intent. Dr. Dunn's mentioned that indeed she will do that tomorrow, and we did receive notice earlier today around, I have the exact time, around noon, 12 p.m. So tomorrow she'll be sending through the formal request. I will not terminate that request, which means this decision is now in the hands of the county council. I'll be honest, I'm heartbroken that we're here as our kids are close to entering school. They'll be entering next week, many kids, and we know that they're entering at sadly, a time where the Delta variant is very, very aggressive. And with that, Dr. Dunn's articulated to the county council, has answered their questions of the need to take the step that she's taken. I'll tell you, I am disappointed that we did not see the continuation, frankly, of the first and aggressive variant of COVID-19, in that I think we were on the right path. We all need to do everything we can do to keep this virus under control. I'm concerned about school kids. I'm concerned that they stay in school. We know that masks work, but I'm also concerned about the future of our community, and we need to put COVID-19 behind us. That means all hands on deck. That means me accepting her wise counsel and request. And it also means that we all continue to do our share. I've started wearing this again in the grocery store. We've changed the policies in this building, actually asking the people who are not vaccinated. Well, we did previously require that those not vaccinated wear a mask, and now we're asking those that are vaccinated to wear the mask, knowing the aggressive nature of the Delta variant. So with that, we now are hoping that the council actually doesn't meet, that they let the request stand, and that starting Monday, kids will be able to go to school with the mask requirement and with that uniform policy in place. I'll tell you, when we had mask mandates for the general population last year, there was a lot of angst going into that decision. There was actually quite a bit of comfort and peace throughout the community, for the most part, once the mask requirement is in place. And that is what we want to see in our schools. We don't want teachers on the front line having to mitigate that challenge. We want them to have a policy to implement for all, and that's going to keep our kids safer as a whole. And that's the intent of moving forward. With that, I'm happy to take questions, or I'm sure Dr. Dunn would be as well.
When would it be official?
So we worked with our we worked with our county attorney's office today to look at the bill, and we are following the procedure set in place by Senate Bill 195. It requires a health department give 24-hour notice to the chief executive, in this case me, that there's an intent to issue an order of constraint. That means tomorrow at noon, she could then, or I could then, let me start over. The county council could then tomorrow at around noon determine whether or not they wanted to meet. We're asking that they work more quickly than wait till maybe even next week, knowing that the schools need some assurance one way or the other. So having talked to Council Chair Steve DeBry, we're hopeful that there'll be a council meeting on Thursday, if indeed they want to go perhaps with the reversal of this decision.
They'll be the final say, the county council?
County council is the next step. The final say rests with the Utah State Legislature. So if indeed the county council chose not to act and to let the order of constraint stay in place, then the legislature could step in. Whether or not they would have to call a special session or go through some other means, I'm not certain about that. But the sequence of events is the county health department, then the chief executive, then the legislative body, and then ultimately the state legislature.
Is this different than a state health emergency where I was told if 30 days would pass, the legislature would have to say something? Could this stay in place if officially passed for the whole semester, for the whole year?
Well, the Senate bill is highly complex. And I'm not certain yet because we haven't seen the final language, given it hasn't moved forward. The attorneys are looking at it now. They may create a window of time. There may be a request to create this into perpetuity, but the legislature, once our county council acts, could indeed step in at some point.
Dr. Dunn, you said on there several times you wanted to avoid this drama. What changed in the last week or two?
Yeah, so I actually had one-on-one conversations with the majority of our county council members, and they said they wanted to see a mask order in their hands before they were willing to decide whether or not that they would seek to support it or overturn it. So we're using the process that was given to us, and that's in Senate Bill 195, and it does start with me, and that's okay. And it is in the best public health interest and the interest of our students for them to be in masks in the fall, to keep them in in-person learning with the least disruption possible and the least health concerns possible. And so that's why the mask order is in place. And like Mayor Wilson said, it will now go, with her support, it will now go to the county council, and they can decide whether to support it and let it stand or overturn it. And that's the process that has been laid out for us.
Okay.
Have you spoken to members of the state legislature?
Sure. So not one-on-one. They've been in many conversations with public health leaders, and I've been included in those over the past several months. And I am comforted by the public statements that both Speaker Wilson and Governor Cox have made when they say they are supporting local health departments to work with their school districts and their local elected leaders to determine what's best for their jurisdictions. And I am really comforted by that, because that's really where these decisions should be made.
Could I speak to the question about drama? There's far less drama in a school where all kids are wearing masks than a spread of COVID within that school and kids being sent home to address illness or to be put into quarantine or isolation. So I think this is the less dramatic approach, looking at that cost benefit analysis from the school children perspective. Not only does this better protect their health, but there's indeed less drama if we're not seeing some kids in masks, some not, parents weighing in. If there's one set of rules for the entire Salt Lake County school system, that to me is a cleaner approach and one that serves our kids.
What's the enforcement like for this? I mean, provided you get past the city council, or the county council and get past the legislature, what's the enforcement for this activity in schools?
I mean, it is going to be a requirement, and we will not do any additional enforcement than what we did last year. So it is expected that parents and teachers and students band together to understand that this is the way we need to go as a community in order to keep our community safe from even more scarier, additional, stronger variants circulating. And it is in the best interest for the community moving forward. So we won't have any additional enforcement, to my understanding yet, than what we did last year.
And Dr. Dunn, you addressed this during the council meeting, but let me ask the work session, but let me ask it again. Why K through 6?
Yeah, so, when we're weighing again those risks and benefits and the tolerance of not only our elected leaders, but also the community to once again have a mask mandate, the decision was made to focus on K through 6 because they are not able to be vaccinated. They have no ability to protect themselves from the COVID virus circulating. And once they're going into the school setting where they're going to be in crowded indoor settings where we know COVID spreads, it's our duty to give them every opportunity to stay safe and stay in in-person learning, and wearing masks is that ticket. Our 12 and above have the ability to get vaccinated, and we encourage those parents and students to use that as their primary means of protection.
Is 6 days enough time for these school districts to get ready and to implement this?
I have been talking with superintendents and school leaders from private and charter schools for the past, ever since I took this job, and they're well aware of the conversations that have been happening. Some of them already have masks available for their students. We at the county have masks that we are going to be distributing to those who need them. And then, of course, the governor has made his commitment to also supply masks. So once again, they have been included in all of these conversations and won't be surprised by this.
Have enough kids age 12 and older been vaccinated to prevent, say, an outbreak in a junior high or high school?
Sure. Time will tell, but I don't think so. So 12 and older, we have around 45% of our 12 and older have been fully vaccinated, which is incredible. We are increasing very quickly the number of kids 12 to 17 who are getting vaccinated, which is fantastic. We have seen spread with those low vaccination numbers, and so that's why we're encouraging parents and students to get their vaccination in the coming weeks. And we're also hosting, just in the next week, 13 vaccination clinics at schools to provide that access more readily.
And several members last week in the meeting indicated they would not support a mask mandate. Do you feel that the stats and the rising numbers will change their minds?
I don't know, and that's kind of the clarity I was seeking, and it's fair for them to want to see that order in front of them before they make their decision. As always, I am more than willing to speak with them one-on-one or as a group to supply any information they need to make their decision.
As it's currently written, how long can this order stand?
So that's something I'm still drafting with our attorneys. We will look at things like metrics of cases, but also the availability of vaccination and anchor to the same metrics that we have been using throughout this pandemic to determine when to lift mandates.
We've heard from parents for weeks, months now who are vehemently against masks. What is your view with them? What would you say to them today?
Yeah, we all are in this together, and we need to ensure that our kids have a fun and safe day one, week one of school starting. And that is on us as adults, us as parents, to make that happen. So regardless of whether or not the mask mandate stands this week, I encourage all parents to work together and to commit to making sure that that day one and that week one of school for our kids is fun and as safe as possible.
Dr. Dunn made a point in the council meeting today that our school system was actually a model for the state. Would you Sure. Or for the nation, rather. Would you?
Yeah. So in the fall of 2020, when we were having our surge, right around the November, December mark, the CDC came out here and worked with 20 Salt Lake County elementary schools to determine how much spread is happening in the elementary school setting. And at that moment, we had all of our kids in masks. And they found that only 0.7% transmission happened in elementary schools, or 0.07. So 7 people were infected for every 1,000 individuals exposed, which is incredibly low. And that became the model for national guidance that is now informing K through 12 guidelines across our nation. And so we were a model for how to have kids in-person learning safely in the fall of 2020, and I encourage us to do that again in the fall of 2021.
Does that tell you that masks work?
Yeah, I mean, and that's, this was brought up at the council meeting. We don't have a randomized control trial to really understand the exact effect of masks, but all the evidence is pointing towards masks do limit the spread of COVID-19, especially for those who are unable to be vaccinated. And the risks of wearing them, the benefits of wearing a mask far outweigh the risks. And it's important that our kids are in-person learning, not disrupted by having to be home because they're sick with COVID or that they were a close contact to someone who had COVID, and masks are a great way to do that.
Okay. And we'll send forward the actual order of constraint tomorrow when it's prepared.
Just to clarify one more time, when does the clock start on this?
So the clock started today at 12:12 when Dr. Dunn sent notice, as required by the bill, to the chief executive, to me, stating that she would be sending forward the order of constraint. I can go ahead and read it to you. In accordance with SB 195, this is written notice of my intent to issue an order of constraint requiring masks for students under the age of 12 years while indoors in the school setting. So the clock started, that means 12:12 tomorrow. The order can be sent forward to me. At that point, the county council at any time can weigh in if they choose to do so.